I'd like to take this opportunity to invite you officially at Lumumba Sub-County Hospital. Lumumba Sub-County Hospital is a child and mother-friendly hospital. But today we are privileged to be friendly to all of you, whether you are a mother, whether you are a child, whether you are a man. We are going to be friendly to all of you as we invite you in this occasion. And I believe that all of you are aware that the occasion for today is to launch a strategic plan. We would like to launch our strategic and investment plan. And this strategic plan is going to help this facility going forward in planning and ensuring that whatever we have put in place is done. Everybody dreams. Wherever you are, you dream. Sometimes you build castles at night. When you wake up in the morning, you realize you are just building castles. And sometimes you can be building castles based on the smaller castles that you've been building. So I want to believe that in our tour, as we were moving around, we have seen the little castles that we are bringing that is making us think much, much bigger to have a strategic plan. You have seen our pediatric ward that we are opening. It looks very neat. You have seen our maternity, the way we are taking care of our mothers who have delivered. They are very neat. You have even seen the patient flowing in the facility. The number is very, very big. And if you look at the surrounding, you can see skyscrapers. So we felt that it was very important that we sit down and dream. Because all these things, when they are happening, you need to think very fast about them. As soon as probably these houses will be occupied, I don't know what will happen to this facility. So I want us to imagine maybe some 5 years or so when we will be having this catchment here, what will happen to this facility. I wish affordable housing was extended to Lumumba Sub-County Hospital so that it can also help in expanding the infrastructure. So that is our dream. We have started it small, as you have seen, and you are moving around, and we are thinking much, much bigger. That is why we decided to be strategic enough to pen it down so that we can have a document that will be guiding us. We would like Lumumba Sub-County Hospital to be a leading mother and child hospital, providing excellent, compassionate, general, and specialized services in Kisumu County. So the catching word there is a leading. So you can't lead if you are sleeping. Leading is not easy. And that is why if we want to be a leading hospital in child and maternal care, we have to be strategic enough and think about it in a big way and put it in a plan, possibly 5 or 10 years. We have strategic plans for even 10 years.
So it is my great honor and privilege to welcome you all to this very significant occasion, the launch of our strategic and investment plan, and the official opening of our pediatric ward.
So today, on behalf of the Deputy Governor for Kisumu County, Dr. Matthew Sowili, I hereby open this new pediatric ward in Lumumba Hospital. Which date is this? 13 April 2026.
So we are starting, we are happy, we are energetic, we are ready. We have been waiting for so long, and we finally welcome you, the entire team, to our facility. As you can see, we have begun with colors. We want to continue very colorful, and hopefully with the support from the county government, county leadership. We are dedicated down here. We are only asking for support from up in terms of human resource for health. There's still some very critical equipment we do not have in as much as we have decided to start. But we said chaka chaka. So we will start as we wait for what is coming. We have begun mentorship for our healthcare workers. We've started training the nurses in pediatric care, what is expected. And our main aim is to ensure that this becomes the center of excellence for pediatric care in the county.
Today marks a major milestone in our journey as a health institution. It reflects not only how far we have come, but more importantly, where we are determined to go. The strategic and investment plan we are launching today provides a clear roadmap for strengthening service delivery, improving patient outcomes, and ensuring sustainability of our services. This plan is anchored on key priorities: improving infrastructure, enhancing human resource capacity, strengthening health systems, and embracing innovation and digital health solutions. It is our commitment to delivering quality, accessible, and patient-centered care to the community we serve. Ladies and gentlemen, the opening of this pediatric ward is a proud moment for all of us. Children are the foundation of our future, and their health is a responsibility we must all take seriously. This new ward is designed to provide a safe, child-friendly, and well-equipped environment where our young patients can receive the care they need with dignity and comfort. This achievement has been made possible through collaboration and partnership. I wish to sincerely thank the county government, our development partners, and all stakeholders who have contributed resources, expertise, and unwavering support to make this vision a reality. To our dedicated staff, I commend you for your resilience, professionalism, and commitment to service. As we open this new chapter, I urge you to continue upholding the highest standards of care, compassion, and integrity. As we implement this strategic and investment plan, let us remain focused, accountable, and united in our purpose. Together, we can transform this facility into a center of excellence and a model for quality healthcare delivery, especially for our mothers and children. In conclusion, I reaffirm our commitment to improving the health and well-being of our community. Let this launch not just be an event, but the beginning of a renewed journey towards better healthcare for all.
I'm here standing as the so-called consultant for this strategic plan. And the master of ceremony has adduced that they didn't give me any money. So I did this thing for free, and it is for public domain to know that I did it for free. So the CCM, this is a very brief summary of this strategic plan. First of all, I want to thank the board chair, Dr. Monica Ogutu, for giving me the opportunity to consolidate the views of the staff. What is in this strategic plan is not my view as an individual. I have no interest whatsoever to influence how this hospital is going to be managed in the medium term. But what is here is a consolidation of all the information that I gathered from the staff of this hospital and the stakeholders that are in this hospital. I want to say that this is a humble beginning. It is the first strategic plan, and it is a medium term, meaning up to 5 years, and then thereafter we can see another strategic plan going it forward. It focused on mainly 4 pillars: the human resource, the equipment, the finance, and the quality of care. And it was done through consultation and public participation of all staff, the board members, and the stakeholders that work in this hospital. So this strategic plan, as you will be reading it, is a culmination of all those ideas that the staff were envisioning. I may not have twinned a very good story in this strategic plan, but it is a good beginning that any other strategic plan and any other plan that comes thereafter will be based on it. Without further ado, I want to thank all the people who are involved in this one, especially the board chairperson and the members of the board who gave me this opportunity, and also I presented for them, and they also gave me their feedback during the development of this strategic plan. My wish, Honorable CCM, is that this plan is implemented as humanly as possible. As you may have gone around and seen, the number of clients who are here, who are seeking for healthcare versus the number of staff here, the amount of burnout in this hospital is unimaginable. Currently, the staff complement is about 38, but in this strategic plan, we are actually proposing in the medium term at least 151 healthcare workers to deal with this queue that you saw yourself in this building. People prefer this hospital above any other hospital around this area. And you cannot kill people and stop them from coming to this place. Even if they come from far as Manyata, Nyalenda, and wherever, they will still come here. So the only way is to remedy this place by having enough HR, enough equipment, and to improve the quality of care. I want to thank you all, and that becomes the summary of this strategic plan. Thank you very much.
As a board chair, I think I'm the happiest person today. As already said, this is our first ever strategic plan. When we were appointed to be in the board, the first thing I looked around and we said, how do we continue without a strategic plan? How do we know where we are, where we want to go, and the priorities? So we prioritize the development of the strategic plan. And Dr. Kennedy, thank you for offering pro bono services, because again, we didn't have money. But when I reached out to Dr. Ganda told me, don't worry, we have our own. And our own also accepted without really giving us a lot of challenges. And we started immediately. So the Lumumba staff, you might not know, but the community appreciates you. We really, really appreciate all of you. You make us proud as the board, because when you're out there, you also want to listen to what people say about the facility. So when we started developing the strategic plan, DG, we at the board, we believe in priorities. First of all, we looked at the facility and thought, do we start with infrastructure? We said infrastructure might be there, but we might not have human resource. So what is our priority? Then again, we looked at the vehicle. We don't have a vehicle here. And we said, I think I reached out to Waziri. And we said, we don't have a vehicle at the facility. And again, with limited resources, we had put that aside and said, we can optimize the resources we have to make sure that we add more staff. And we were allowed to recruit more staff, and that is how the postnatal ward was opened. And today, I'm happy that we have opened the first ever newborn pediatric unit. Newborn is coming to my lips because that was my priority, and I hope it's coming soon. Thank you, our able pediatrician. I know that has been your wish all through. At one point, she actually threatened that if that pediatric ward is not opened, a newborn unit, she doesn't need to be here. She will move. And I told her we are going step by step. We'll be there. So today, the pediatric ward is open. And we need to celebrate. Because when it is the staff actually pulling, it's not a push from the management, things work. So this is really the pull approach from the staff. Again, I want to emphasize that this strategic plan is not just going to be a document. It's a shared vision that we have together with the staff. And it focuses on only 4 key pillars. The first one is human resource. And I cannot underemphasize that. It's human resource, human resource, human resource. When we started this meeting in the morning, we sat here as the board. And the traffic that gets through that gate, it's huge. And it's mother and a baby and the man. You know, this is a facility that I've seen and witnessed real male involvement. The men are behind they are either the pregnant woman or the woman with the baby, and the traffic is there. When you go to the waiting bay, the men are seated very comfortable with their wives, with their children, and the children have a corner where they are able to play. So it's already a model. So we just need to invest on human resource. The other priority area is the supplies. Again, when I entered the pharmacy, This is the first facility you enter, the pharmacy, and you feel like you are in the hospital. Congratulations. Because in some of the facilities, the clients are many, you enter the facility and the shelves are empty. And we know no supplies, no services. This confirms that we are offering quality services. The other priority is continuously to improve quality services, because quality sells itself. You don't need to go out there and tell people we are offering quality services. They will come for it and they'll go and market it. Lastly is about the financing. We need to ensure that we secure adequate and sustainable financing to enable this facility offer seamless quality services and have equipment that we need, supplies that we need, and will be able to reach, the entire Kisumu County. To His Excellency, this is a facility that we can have as a center of excellence. When we talk about a center of excellence, it's also a hub for training. We are already seeing students. They are here. Then we need to ensure that this is a facility of choice. So as we launch this strategic plan, our plea as the board is to address the gaps that are there that were listed. It's a very simple to read. It's a user-friendly document. Anybody who does not get a copy, please scan, go and read, and you'll see how easy it is. It will give you the direction. We are also, lastly, in consultation with Dr. Kennedy, we are coming up with an implementation framework, because we want, by the end of these 5 years, it is 2030 strategic and investment plan. After that, midterm and end term, we will evaluate and tell you that it actually worked for us. Our last priority that might come later is how to address the infrastructure, because we are seeing that we might have so many other clients that we didn't plan for. So how do we expand? Do we go upstairs? Because when I was in Kenyatta, we used to be in King George. And when we realized that the facility was small, anybody who was in King George those years, you saw now it was now the Gorofa that came, and it took so many wards. So maybe in future, the county government and the national government can rethink going, the sky is the limit. We can take Lumumba to where it can reach and ensure that we offer and serve our people with a quality lens. Thank you so much.
The health facility, the board management, and of course, colleagues from the county, sub-county, and the hospital. Good afternoon. Well, my name is Frederick Olwat, Director for Public Health Sanitation, Kisumu County. I recognize the presence of Evans from GTRH. You know, you're from national government. Thank you. Thank you. Thank you so much. So just to recognize the team from the CHMT, County Health Management Team. I know Tieno is there, Mamo is there, we are there. And then the sub-county team, I've seen Dr. Collins Omolo and of course the other teams. From Lumumba, Mko, CHP's wako, of course, and of course our guest. So I want to really appreciate what we are seeing today, and I want to tell you, as we see the strategic plan, I only see strategic leadership. It is about the strategic leadership that has brought about the strategic plan. Lumumba has really made us proud. Your Excellency, this hospital has never had any maternal mortality since. And they don't brag about it. They are quiet. No maternal mortality since they opened that theater. And they don't brag about it. It is acting as our digital hub. And you will see the digital hub, the center. So when they say that they are talking about excellence, center of excellence, then they mean it. But we appreciate the partnership that we have seen here. Our partners who are here, who have supported this. Tuko na Kemri. Wako? Yes, Kemri. Thank you so much. We have Nyanza Reproductive Health. Wako hapa? The UNIM? Are they there? We have CHEB. CHEB wako? Yes, and also Kiswa. We really want to appreciate so much for the support and the investment that you have put in. This is a real model of public-private partnerships. And then the motivation of healthcare workers. This is a place where we only get positive reviews on the social media. You do not have to be defending them because the people only talk about good things. You actually should be a center of learning for everybody else, center of learning and exchange, so that the other hospitals can as well come here and learn from you. So we appreciate this, and I know this is on patient-centered care. Patient-centered care. And this is our maternal child health hospital. That is what, when Dr. Ganda joined us, he looked at things and he said, for Lumumba, we want to see it as a maternal child hospital. And it is with the good leadership of the board and the medical superintendent, it is turning into what we wanted. And hoping that we will even do better. With all those, I really want to take this opportunity to invite our County Executive Committee member for Medical Services, Public Health, and Sanitation, Dr. Gregory Ganda. Can we clap as he comes?
Our board members, CHMT members, and all guests who have been invited. Habari zenu? Yes, before I give my remarks, we have a guest, a special guest from the national government. We have one of our own who is the Director of Finance Administration at JOTRH. You know, he has now grown and now he's there, so we must give him his honor as having represented Jaramogi. Karibu. A clap for him, just one clap. You guys have been very mean with the clap so far. Karibu Evans.
Your Excellency, the Deputy Governor, Dr. Matthew Owili, Waziri Health, Director, Public Health, Board Chair, and board members, colleagues, and invited guests. Good afternoon. Bwana asifiwe. Thank you very much. Waziri, I remember sometimes back when you used to talk about Lumumba being a maternal and child hospital. It's now a reality. And we must really take this opportunity to thank you so much because it has been a priority in your vision as the Waziri Health. Now it has come to a reality. So to our colleagues, Lumumba, we are here to support each other. Our priority number one is having a healthy county. Despite us being in national government, JOTRH lies within Kisumu County, and on behalf of the CEO of JOTRH, Dr. Joshua Clinton Okise, whom I'm representing today, health is a priority. And when we have a healthy county, everything will go as planned. So we are here to support you. Cases that maybe you feel cannot be done here, we are just a stone throw. And we'll always be partnering with you people so that at least we have a healthy county. Just as the politician here, I know you have a lot of passion towards children. Even us at JOTRH, we are doing a Piku Niku through M-Pesa Foundation, so that in case of anything that you need services across, feel free and come over. So I won't take much of your time. Despite being in the national government, we are still colleagues. We are still colleagues, and Musiogope, I took on the national government, no. We are one team. We are still in the county government of Kisumu. We are still doing the transition process. We are one. Sawa sawa. So you receive greetings from the CEO of the hospital. He was supposed to be here, but he's held up somewhere else. So I was representing him today. Otherwise, with those few remarks, thank you very much, Waziri, for having felt it wise for me to say a remark. Thank you very much.
Everything that we are doing was part of a plan. And there is nothing that was out of this plan. I am just the implementer of the plan. You know, the owners of the house are the governor and the deputy governor. Actually, the deputy governor sat me down and showed me the vision. You must have a theater here, you must have a theater here, when I was in my first week of work. And so all this plan is coming to life. And I say, you know, this is become an architect. When the owner of the house tells you, draw it, you draw, you take it to him, he says, no, I want this one here like this, like that, you go. And then now the architect gets the contractors, like in a Fred. Now they build it. So I'm very happy that the Kisumu County actually is moving in that direction. And as Evans has spoken, even the team in JTRH was built by us. It was all part of the design. As we see them there, we are very happy that they are there because they are all part of this health ecosystem. Coming back to Lumumba, Your Excellency, this was a hospital which used to be for mothers. Many years ago, it used to be a dispensary and then a health center. And so we were very strategic. I know we sat down with Governor when we were choosing who leads this place, because we said, without governance, you have nothing. And so we had to decide who governs this place. So it is not by default that you had a board chair who was in Kenyatta National Hospital, the highest hospital, who is known for quality, who runs one of our biggest partners, KMED, to be the chair here. And we had community representative, somebody who stays for me, who really represents the community. We had a doctor who is a gynecologist. So the board was designed from the beginning. So what we are seeing is a reflection of the plan we had. We knew we put the right people in the right places. We give them the support. They should be able to deliver. Excellency, that is 100% this administration. We built this from scratch, equipped it from scratch, and put the human resource from scratch. And so it is a reflection of our administration 100%. So we cannot hide anywhere. And so I'm very happy as we come here to launch, because we said this is not going to be a volume facility. This is going to be a quality facility. And we have seen it progress, starting from the outpatient, moving into the inpatient slowly, and now moving into the pediatrics, step by step. Because we are not just saying, let our watu wakuje admit. We are saying, what do we want to offer? I'm very happy with our pediatrician. At one point, we thought she had run away. Simama, watukuone, makofi kwake, please. Thank you. She went on a consultancy for 1 year. And the board almost hanged me because they didn't have a pediatrician and we had already given them one. So she's now back and she's actually a top pediatrician in this country. She does a lot of policy for this country, and Affair House consults her there a lot. So you have the best. You have the best medical superintendent, I told you. I pulled her from JTRH at that time when she was heading the clinical services, and I said, this person is worth being in charge over here. So everyone, the nursing director over here was almost the nursing director of JTRH. In fact, she was the best. We had 2 who topped, and we had to choose one. So you have a very good team to be able to deliver. The future is here. But as we go into this future, you see what is going on behind. This is going to be a nightmare for us if we don't think ahead. So we must think. And I know I sat with the board and we have thought. And we will have solutions. The solutions will have to come probably the next 1-2 years, but there will be a solution for this, so that we have an outpatient. One of the things we can do in the immediate is this other block should actually just become an outpatient block, so that there's a way inside there for those guys who want to come malaria treated. Then you keep this side for maternal and child health. But you will need more land so that you go upwards. When Dr. Lucy told me the first thought about a different hospital, when we were putting up Lumumba, we thought we were going to crash KCRH, bring it down, and move everybody here. But you know what happened? When you built this here, it was full and the other one is full. And so I've kept asking, where are these people? Where are the numbers coming from? What's happening is private patients are slowly moving away from the private sector to the public sector. That is why you are dying with work. The number of deliveries has not increased. Everybody is moving towards quality, and it's a good thing because the public must direct quality. So if the private sector wants to have clients, they must beat the public sector. And that is how quality is improved. Quality is improved by competition. You must give the best, people move to the best. So now Lumumba is the best, people are moving here. When you slow down and you start sleeping, another one will open a center the other side. They will move that side. Who is the main benefactor? The clients. So I'm happy to be here, Your Excellency. I know today is not my day to speak. It has been a journey with Lumumba, but I'm happy we are going to finish on a good end, that we are going to have a strategic plan that is going to cover us for the next few years. So it is up to us to build this foundation and ensure that this plan that has been envisaged will continue into the future. Thank you very much, all our partners who have supported us. Thank you for the team members here. This is a very dedicated team. I'm very happy whenever I look at Lumumba, almost every day. Pamela knows, because this is where most of our mothers now are coming. This is the busiest outpatient, public outpatient, apart from Jaramogi. Actually busier than Jaramogi now, in terms of general outpatient. Bigger than KCH, busier than all. This is where the numbers are. So this is where our focus should be.
In fact, we are very excited, Daktari, for this great milestone of our facility. Yeah, you can see the environment is very friendly, very safe, which is the spirit of the pediatric care. And you know, there's no shere without the cake cutting. Yes, so this cake represents safety of the patients, hope, and the healing power. So as we cut it, we mark the beginning of a journey with the pediatrics. So she will assist you to cut the cake. Na wakikata tuwapigie makofi. 1, 2, 3. Yes.
It has to be.
Akilisha mtoto tunaweza mpigia makofi. Yes. I want to go.
Thank you.
And then I will call upon our board chair.
This is a commitment that this is going to be a center of excellence. Amen.
So thank you very much.
So my brother, the county cabinet member in charge of health and sanitation, Dr. Gregory Ganda, your team, both from the department and your team within this facility, the board of management, Dr. Monica Ogutu, you and your team who are here, and you have a very supportive team. Every time I come and you have a function, they're always here. Our development partners, I was not here when you're being introduced, but allow me to recognize all of you from all, spaces where you come from. Our very distinguished guests who are here today, our healthcare workers, the leadership of this institution, and of course, the Nyamreros. Ladies and gentlemen, I really had wanted to be here this morning and on time. And Dr. Ganda knows about this because it is something that we discuss. One thing about me and this facility is that I like showing up when you invite me because you guys are doing a very, very good job. It gives me great pleasure to join you here today for the official launch of the Lumumba Sub-County Hospital Strategic and Investment Plan 2025-2030 and the opening of a new pediatric ward, two important milestones that reaffirm our administration's commitment to strengthening access to quality, responsive, and people-centered healthcare for residents of Kisumu County. Now, from 1966, when this space was launched as a dispensary, to 2026, where it is a level 4 powerhouse. Let us reflect on where we started. In 1966, we stood here. What stood here was a modest municipal dispensary. And for decades, it served its purpose. But it lacked the wings to fly alongside the growing needs of our people. And you know, the governor did say that Kisumu should not be walking with the chicken. So that should be in all departments. So Lumumba really is now flying instead of crawling or walking. During our first term, we made a deliberate choice to stop the patchwork approach to healthcare. We completed the core infrastructure of this hospital barely 7 years ago, transforming a municipal health center into a modern facility. Today, Lumumba Sub-County Hospital has earned its stripes as a level 4 facility, boasting of a functional radiology department, an emergency wing, and a reputation for excellence. Now, these milestones are not symbolic gestures. They represent, ladies and gentlemen, deliberate progress in building a stronger county health system, one that protects our children, supports our families, and ensures that healthcare services are available closer to the people who need them most. The strategic and investment plan, and I like the word investment, because I think in public sector, we rarely think about what you do as investments. But these, ladies and gentlemen, are basically really investments. Investments in healthcare and investments in the future. So the strategic and investment plan 2025-2030 we are launching here today is our roadmap for the next 5 years. And it is built on 4 non-negotiable pillars. Underline the word non-negotiable. One is modern equipping and infrastructure. A hospital cannot run on goodwill alone. Under this plan, we are moving beyond basic care. We are investing in advanced diagnostic tools and medical technology. We want Lumumba to be a center of excellence for maternal and child health, where no life is lost for lack of equipment. You hear me? And I hope that my brother from JTRH has heard me. I was at the Center for Negotiation for Funds to build their neonatal and pediatric ICU, where Safaricom Foundation gave us, I think, almost 100 million to do that. But I want to tell him, I think that they'll be referring their patients here, because we are the center of what? Excellence. Yeah, so let's keep that. If you're the center of excellence, then it does not matter whether you have a big brother. The big brother can still come to you for something that you are excellent in. Number 2, bridging the human resource gap. Now, walls and machines do not heal people. Healthcare workers do. We are committed to closing the staffing gap. We will ensure that every ward has its nurses, every theater has its team, and every patient has a specialist. Now, as the CEC has already said here, Dr. Greg, and sustainability through the Social Health Authority, SHA, we are living in the era of SHA. For this hospital to thrive, it must be financially resilient. Under this strategic plan, every service delivered will be meticulously recorded and reimbursed. We are institutionalizing a culture where every shilling earned is reinvested into better medicine, better tools, and better services to you. And so I've seen there you're already registering people for election in 2027. But I hope you're also registering people for SHA. Those who come and are not in SHA, really, as a priority. In fact, I think the SHA people should just be next there, if you do not have a dedicated desk for them. Number 4 is quality and digital transformation. We have already achieved full digitalization at Lumumba using tools like Safe Mama Tech to track high-risk pregnancies and improve clinical decision-making. We will continue to leverage technology to ensure that access does not come at the expense of quality. We are not interested in volume without value. We want every patient to feel the impact of the Kenya quality model for health. Today, Lumumba Hospital stands as one of the busiest public health facilities in our urban network, serving over 10,000 patients every month. I was going to doubt this. 10,000, no, that's huge. And that's before these guys move into these houses. Now, that growth reflects something very important. One is what you call public confidence. Now, confidence in our healthcare workers is number 2. Now, confidence in our investment is 3. They like what they see. They like what they get when they get here. And of course, confidence in our commitment as a county government to strengthen healthcare indicators. Recent service data continues to show strong maternal and child health indicators and high immunization coverage with low dropout rates, evidence that this facility is already playing a critical role in protecting families and safeguarding the future of our county. However, this success also brings with it new responsibilities. Now, Lumumba sits within one of the fastest growing urban catchment populations in the county of Kisumu. Now, with expanding housing developments, increasing population density, and growing service demand, the pressure on health facilities is rising very steadily. Now, this strategic and investment plan is therefore not reacting to change. It is preparing us for the future. The question before us today is not whether Lumumba Hospital is performing well. I know we are. The question is whether we are ready to match that performance with investment. Okay? Now, because performance without investment cannot be sustained, and as a responsible government, we must ensure that success never becomes a burden to our health facilities. Lumumba Sub-County Hospital will continue its transition into a center of excellence for maternal and child health services within our urban health systems. The opening of this pediatric ward signals the beginning of that transition. And now, Dr. Ganda, you know that you retain top-notch professionals if your facilities are also top-notch. Yeah, and so I think it's something that we can work on in all the sub-counties. If you want to have a pediatrician in Seme sub-county or in Nyakach, and they have no space to practice, they may not be there. So I think going forward, in the remaining time, or in future if I take over, no, when I take over actually, we will ensure that we have spaces, especially for, top-notch professionals in all areas. Yeah, because I think in this era and age, you must be able to see the specialists within the sub-counties. You don't have to always travel to the center. Yeah. So children in Kisumu now have expanded access to specialized pediatric services very close to their homes. With this development of trained clinical personnel, including a pediatric specialist and dedicated nursing teams, we are ensuring that children receive timely, dignified, and quality care within this facility without unnecessary referrals. These developments are not isolated. They are part of our wider transformation strategy within our devolved health systems. Now, our administration will continue to strengthen service delivery across all levels of care, from the community health services and the primary health care facilities to sub-county hospitals and referral institutions, guided by an integrated model that prioritizes promotive, preventive, curative, rehabilitative, and palliative healthcare services to our residents. As we implement this strategic plan, partnerships will remain central to our success. We welcome collaboration with development partners, research institutions, private sector investors, and community stakeholders who are committed to strengthening maternal and child health services, expanding infrastructure capacity, improving clinical training opportunities, and supporting innovation within our healthcare delivery systems. Our healthcare workers who are here today, we see your dedication, and especially in this facility. We recognize also your sacrifice. We know that healthcare workers sometimes work really beyond normal working hours. And we remain committed to supporting you with the tools, staffing, and systems required to deliver quality services to our people. To our partners and healthcare workers, to the Jali Watoto Foundation, this is an opportunity to work with us in building a stronger and more responsive county health system. To the people of Kisumu, this is your hospital. Mausiptandu. This is your investment. Mabenden Mwandu. And you have every right to expect quality healthcare services. In closing, ladies and gentlemen, the strategic plan we are launching today is not just looking at 2030. We are building a legacy for generations. This is true meaning of devolution. It's not about administrative boundaries. It's about transformation of lives. It's about a mother in Kisumu knowing that her child's life is guarded by a world-class system. It is my singular honor now, on behalf of the governor of the county of Kisumu, who is my boss, to officially launch the Lumumba Sub-County Hospital Strategic and Investment Plan 2025 up to 2030 and commission the newly new pediatric ward. I suppose this was done on my behalf by Dr. Ganda. We are very good friends with him. Thank you, and may God bless our county of Kisumu. Yeah, so at least now you have a path, yeah? You have some kind of compass, to help you navigate what you must do in this space. Kwa hivyo sisi ni kuwashukuru tu and to, congratulate you for this milestone. You guys work very closely together. I'm here, I work here and I've been here for some time. I visit many places, I visit many sub-counties, but I think what we have here is really exceptional. That's why if there's any chance to come here for any reason, apart from being sick, I'll always find time to come. So, asanteni sana. I know that we also need to do many other things. We don't want to keep you here for too long. And so I turn it over now to you. Thank you.
Thank you very much. Thank you very much, His Excellency. This facility, we work very closely with the community. So we have got our community health promoters here. One of them is coming here just to say thank you for your...
So ladies and gentlemen, on behalf of the Governor of Kisumu, I now cut this ribbon to officially launch the Lumumba Sub-County Strategic and Investment Plan 2026-25.
That's very beautiful. Very nice.
Raise your hand. Because you know how to make incisions.
This is a commitment that as Lumumba Sub-County Hospital, through the board, we are committing that no woman or child will die from preventable causes.
The board care of the feeding the deputy governor.
In this cake that I'm going to give the board chair symbol as the commitment of the board and the team here to ensure exactly what she has said.
But I'm transferring that commitment to the CC Health because he has to give us supplies, human resource, and technical team to achieve that.
You're right.
Thank you very much.
Follow and make sure it is done.
A coffee.